what are some of the ways you go about preventing chemotherapy-induced nausea and vomiting aimed at improving the patient's quality of life?
Chemotherapy-induced nausea and vomiting is a big problem for patients getting chemotherapy. There have been several studies done asking patients about the symptoms that bother them the most about chemotherapy 20 years ago and about 10 years ago. And every single time, the top 3 included nausea and vomiting. So even though we have developed some new drugs and it's getting better, it is still a big problem. There are some national guideline committees. There's actually 3 major sets of guidelines. Probably one of the most commonly used guidelines in the United States is called the Nccn Guidelines, which is the National Comprehensive Cancer Network. And once a year, we meet and talk about the guidelines so that the average oncologist in practice knows what is the standard of care for helping his or her patient with nausea and vomiting. So we divide the patients up into patients getting highly emetogenic chemotherapy, which means there's a great chance that they'll get very nauseated, or moderately or low emetogenic, and then we try to guide the choice of drugs by that. Of course, we all want the patient to do as well as possible, but it's also true that these drugs have costs, and we certainly would like to be as cost-effective as possible and have as good a clinical outcome as possible. Therefore, if a health practitioner would look at the guidelines and let's say they were treating a patient with highly emetogenic chemotherapy, there are 3 main categories of drugs they have to give the patient in the preventive phase. You've got to try to prevent it rather than treat it when it's too late. One is a group called serotonin antagonists. There's about 3 or 4 choices in that group. One is a group called steroids with dexamethasone. A lot of patients have been on that for one reason or another. And there's another group called neurokinin-1 receptor antagonists. And that's the newest category of drug to be used for this problem. So if the physician is giving highly nauseating chemo and not giving one drug out of each of the 3 categories, then they're really doing a disservice to the patient, because there have been numerous randomized trials showing that these patients do better if they are treated very aggressively.